Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. In the series of the role play, today's role play is again for the nurses, and the setting is hospital reception. This patient is actually undergoing dialysis, and the son or daughter of the patient has come to inquire about the procedure, and your role is to explain the whole procedure and the uses of this, why it is required, and what would be the effect of this afterwards. This is mainly about the dialysis. Now let's start with. So in this case, as this patient is new and you have to introduce yourself. Secondly, you have to gather the information regarding the patient also. You may start with the warm welcoming the patient or with the warm wishes. Hello, good morning or good afternoon. My name is so-and-so and I am the nurse in the hospital reception area. Or you may say that I am one of the registered nurses working in this hospital, or I am your attending nurse today, or I am the reception nurse today. You may start with anything. Then the second part could be, how may I help you? The patient's son will say that I have come as my father has an appointment for the dialysis today. Then your next question will be, or your next statement will be, for the documentation purpose, may I check your father's name and age, please? The patient will say, yes, my father's name is Samson, and he is 80 years old. Then you have to tell, yes, yes, I have appointment with Mr. Sam. Then the next part will be started. As the attendant will have some queries regarding this. This is the first dialysis, and the patient has 3 dialyses per week. And the nurse role is to explain about everything and quench the appetite or quench the queries of the patient's son. Then it's important for you to ask the name. Here you may say, so fine, now for the better conversation, I would like to know that how would you like to be addressed? The patient may say that, yes, my name is Henry. Then you should start the conversation by saying, yes, Mr. Henry, do you know what your father is suffering from? Then he'll say that, not, I'm not aware about this. Then you have to say that your father has kidney failure, and due to that, he is undergoing this procedure. Actually, the function of kidneys is to purify our blood or to filter our blood. And when the kidneys fail at that time to uh, what we can say purify, or we can say filter the blood, or the clean, yes, clean could be the better word, this dialysis process is required to remove or to shed away all the toxicity from the blood. Kidneys are no more working. In that case, it is altered by the dialysis. Now you have to gather the other information. Henry, can you please tell me that for how long your father has been suffering from, or when your father was diagnosed with a kidney failure? The patient may say that it was 5 to 6 months ago, and my father had some problem, and when he underwent investigations, he was revealed with a kidney failure, and doctor suggested us to undergo the dialysis process. Then ask the next. Fine, Henry, I would like to know that your father's daily routine, what does he do? And his other health. Uh, does he have any other ailment like hypertension, diabetes, or anything else which you want to tell me? Is he taking some medication? Because this is important to inform, or any myocardial infarction, angina, any other problem, because during the process he might find some problem. So if he has any problem at the time of the dialysis, it can be managed if the nurse or the doctors are already aware about this. Then yes, this is to be done 3 times a week. And we have to tell that it is a machine which will filter the blood of Mr. Henry. One side, it will be we can say that it will be taking the blood, and from the second side, the purified blood, or the blood which is filtered, that will be administered into the body of Mr. Sam. So in this way, this process will be done. Then the son may ask that, is this process painful? Then you have to reply, it depends upon patient to patient. It might be discomfort for someone, and someone may find it painful. But it is advisable to be strong at that time, and gather your courage to face this procedure, because it will be the first experience which might be painful. After that, when the patient becomes habitual of this becomes common for him, because as your father is undergoing this procedure 3 times a week, in that case, he needs to be courageous. He need to be educated and encouraged regarding this. Mention that his father's medical condition is unlikely to improve. That is, yes, fine. Now, Henry may ask you that, would my father's condition be cured? Is it treatable? Kidney failure, is it treatable? Then you have to humbly say, I'm sorry to say, or I'm extremely sorry, Mr. Henry. This is incurable. Kidney failure is irreversible. Only if kidney transplantation is there, only then we can say that there can be some cure. Otherwise, by dialysis, it is only for some time the body can show progress, or we can find some positive changes in the body, or the body may start working normally, only if the procedure, this dialysis, is continued as it is recommended by the doctor. Then give details about whether the treatment is painful. I've already told you. Yes. Now, Henry may ask you, nurse, is it painful? We have already discussed that. And what are side effects of this? Because I've heard that after the dialysis, the patient are not able to do work, or they don't lead the normal life. Then you have to tell that, Henry, it depends upon patient to patient. Because some people who have strong willpower, they are leading a normal life, and they are doing all the activities independently. But if your father is weak, and he's having weak willpower, in that case, he may find some symptoms. Otherwise, the common symptoms after the dialysis, these are fatigue, low blood pressure, and the muscle cramps, which can be subsided within a few hours by taking some medicine which will be prescribed with a doctor, or it will be subsided by its own after your father becomes habitual to this process. Then it actually warns what could happen if your father decided not to continue with his dialysis treatment. As yes. Now Henry asks you that, nurse, as my father doesn't like to undergo antibiotic treatment, suppose we do not continue the treatment after 2 to 3 dialysis, uh, would it have some bad impact on my health? Then you have to strongly recommend Henry, or warn Henry, I'm extremely sorry to tell you, if your father does not undergo dialysis as prescribed by the doctor, he might have to face direful consequences, like as he's already having kidney failure. In that case, congestive heart failure can be there. There can be other side effects, and in the worst cases, it might be fatal for your father. For that reason, it is mandatory for your father to undergo the dialysis as these are prescribed by doctor, by this 3 times a day. He might feel low, fatigue, but these symptoms are much better than losing his life. So in this way, you may end up the topic, and you can, and by saying, Henry, do not forget to take the pamphlet, which has a complete information regarding do's and don'ts during and after this procedure. And if your father is ready, so may we start with the procedure, because his turn is after this patient who has gone inside the room, dialysis room. Next turn is your father. If your father is ready, then we may proceed further. And may I fill up your form and take your consent In this way, you can end up the topic. I hope this information will be quite helpful for you because I have tried to cover all the aspects, all the points here. Similarly, you do have to do all this in the exam. Do not miss any information because if you're missing any of the important information, in that case, it may lead to deduction in your scores. If you like my videos, do not forget to like and share it with your friends, colleagues, and other people. And secondly, if you have not subscribed my channel yet, subscribe it right now so that the latest information should be with you whenever I'm uploading any new video. It should be with you and you should get the best benefit from this. Thanks for watching. Stay connected. Happy learning. See you very soon with a new video. And if want me to make any role plays video, just comment me in the comment box. I'll definitely make. And if you want to get any other information, please send in the comment box. I'll be waiting for your comments. Thanks for watching. Stay connected. Happy learning. See you very soon with the next video. Till then, bye-bye.